Hey everyone, my name's Chris Winkley. I'm a physical therapist down here in Austin, Texas. Been asked to come help present for you guys about some of the physical therapy benefits for the active older adult and go through these benefits. What is physical therapy? What do we do? How do we do it? Who do we work with? The aging body and your health. So the different systems that we work with, including our cardiovascular, neuromuscular, and musculoskeletal systems. We'll go through how PT benefits those systems for the active adult, and we've also got some PT secrets to pain relief and improved performance, some stuff that I deal with many patients, and try to employ these strategies for people to develop on their own to keep pain down and inflammation. Finally, we'll look at how to get physical therapy. So what all's entailed to get to see a physical therapist, to set up an appointment, and we'll basically run through all this stuff. And if you guys have any questions, feel free to either comment or text them in, and then we'll try to get them in a little bit later. So what is it and how it works? What we do is we work closely with your physician or your surgeon. So we follow their orders, follow their instructions, whether it be you've just had a fall, you've had a shoulder replacement or a knee replacement. We look to work side by side with your physician. There's three different types of physical therapy. The first being acute, which you experience by going into the hospital, having an injury, having an accident home, and you get seen by your physical therapist at the hospital there. The next step is going into home health. So home health physical therapy allows people to get back into home after being in the hospital and be seen by a physical therapist while they're at home and recovering. The final physical therapy is our outpatient physical therapy. This is where patients go to a clinic. We're now offering this at home as well, and you can have a therapist come to your home to do outpatient. And this is when you've progressed past the hospitalization and then past a home health and into a bit more of a stable condition. So what we do, we provide our physical and physiological assessments and analysis to an injury, chronic condition, or pathology, including the musculoskeletal, cardiovascular, and neurological systems. These are sets of assessments we do with patients to determine the problem, the severity of the problem, and then how to treat it and rehabilitate it, which is what we talk about here next. And we've got a variety of treatment options for people, stemming from exercise rehabilitation, manual therapy, our modalities to improve pain and control inflammation. We like to really get the self-education part of our treatment plan for our patients. You guys taking care of yourself really helps us to do a better job at what we do. And then, of course, we got to get that home exercise plan. That's carrying over some of the self-care strategies into a plan that you're going to develop and maintain on your own. So next we'll look at just some of the benefits of physical therapy for the active adult. Preserve and gain strength and endurance. This is a big one. Both of these factors help to progress our function and combat those negative effects of aging. Physical therapy has also proven to improve mental focus, clarity, and ability to perform mental tasks. We found time and time again that if the body is physically active, the mind actually starts functioning better as well. So along with that, we've got retain and improve control of bladder and bowel function. These are crucial as we get older and after having kids, after an injury or prolonged bed mobility, and then a hospital stay, we might have difficulty controlling the muscles that help to control incontinence. And then the main focus of physical therapy is to improve your quality of life and maintain your independence, which is just absolutely crucial to making sure that you stay in the quality of life, the standard of care that you want to be in, that nothing forces you out of your current situation. So first off, what we'll talk about is our cardiovascular system. Many of you have parents, siblings, people that you know that have gone through a heart attack or open heart surgery. It actually is the leading cause of death for people of 65 years and older. So we place a lot of importance on looking at our cardiovascular health. This program that we start to employ with our cardiovascular patients depends on what has happened with you, whether you've had a heart attack, whether you've got high blood pressure, whether you've had a pacemaker procedure, a pacemaker put in, or open heart surgery. Working with your cardiovascular specialist, your cardiologist, we determine and work together to build a program suited for those needs with the phase of rehab after a surgery or after a cardiovascular incident. So along with this, just what I mentioned is the exercise training involved with that. Really important for improving the inflammation, glucose control, autonomic function, behavioral characteristics, your quality of life. Really helps to reduce future hospitalization costs and improves your quality of life. So we work hand in hand, like I mentioned, with the cardiologist to determine the best program, understand the precautions that the cardiologist wants the patient to endure, and then moving forward with that rehabilitation plan. So some of the benefits for exercise and physical therapy with the cardiovascular system, we've got less risk of developing high blood pressure, heart disease, preventing strokes and blood clots. All of those can be life-changing events. Keeping up a regular exercise routine will help to stave off these symptoms, these increases and decreases of your body's blood pressure below a normal limit. Second, we have increased oxidative capacity of muscles and capillary density. This is a crucial one, especially with the capillary density. If you don't have blood flow to a structure in your body, the structure starts to undergo degenerative changes as well as improper function, which can lead to further problems. So the blood flow distribution to the area of the body that you are having concern with is absolutely crucial to getting back to being healthy. Third is to maintain and increase thoracic expansion in the low mobility zones of the lungs. Most of us breathe very apically from kind of the mid-chest up, where we breathe through our mouth and kind of almost pant like a dog a little bit. And that does not generate the best, what we call ventilation perfusion ratio. And that basically means the absorption of oxygen by the lungs. The lungs actually are shaped a little bit like a pyramid. So the base of the lung is a little bit bigger. And if we can slow down our inspiratory volume, slow down our inhalation, and start to fill up these lower lung volumes by breathing through our nose, exhaling through our mouth with what we call pursed lip breathing. So it kind of looks like this. We can really help, and we would encourage patients to take as deep of a breath as possible or as necessary. And that helps to really reach these lower lung volumes and improve oxygenation to your blood flow, which is going to improve your body's response to any function that endures and anything that goes through. And along those lines, the benefits of the cardiovascular PT assists with the diaphragm mechanics to allow ventilation and respiration to occur at a better level and allowing the diaphragm to drop down, and allows the lungs to expand, and then vice versa. When the diaphragm pushes up, this allows the air to exhale out of your body. So the movement of the diaphragm is very important for breathing, very important for getting oxygenation to these patients. So the second system we'll look at is the musculoskeletal system. Now this involves the bones, the joints, the ligaments, the muscles, the nerves, all the physical structures of the body. And we can affect all of this stuff and can give you guys improvements in your technique, all kinds of different corrective rehabilitation programs to help with backs, necks, kind of everything from your head to your feet. One thing I was looking at that I thought was interesting was we have primary aging and secondary aging. The primary aging is more focused on kind of natural degenerative changes that our bodies go through with reduced muscle mass, reduced blood flow, a lot of cellular changes that occur naturally with aging. Then we have our secondary aging, which refers to these lifestyle factors that we can modify and we can better ourselves at to promote our health and to regain function. Along with the secondary aging does also indicate our pathologies that we experience and our diseases, which can have a direct effect on our body. And physical therapy is suited to establish parameters for that patient and work with the unique circumstances we have rehabilitating them. So along those lines, we've got to have a serious exercise program. And what we found is that it needs to be done around 3 times a week, at least. Now, this can be twice a week in physical therapy or 3 times a week, and then up to 1 to 3 times on your own with the guidance of your home exercise plan by the therapist. And one thing I thought was interesting about this was mentions the intensity, duration, and mode of physical activity and nutritional status markedly affect the metabolic and molecular response to a given exercise challenge, and in turn determine the nature of changes in skeletal muscle, oxidative capacity, mass, and strength. So what that means is that each circumstance has to have the right approach, has to have the right rehabilitation model in order to actually gain benefits. If we're not doing enough, we're not going to get our strength coming back. We're not going to start actually improving over time. So we've got to hit these progressions, these standards of care. And this is what physical therapists are directly responsible for, is giving you a specific rehabilitation program that's going to benefit you in the timeliness that you'd like to get better. And that always changes. So some people have a much quicker timeline. They want to get better yesterday. So we have to work with people's unique circumstances. The benefits to the musculoskeletal system with physical therapy, main one is less joint swelling. And this involves a number of different factors that contribute to the health of the joint. And what that means is that if we have increased joint swelling, where there's a buildup of fluid, of blood, of different materials, we have less likely chance of our good cells and our builders, our regenerator cells coming into the area to replace damaged material or replace structures that have undergone strain, and allowing this system around the joint to remove the fluid allows improved pain relief, improved recovery times, reduced use of medications to control pain and inflammation, all through doing a steady exercise program that you feel comfortable with. Along that line is improvement of the joint and muscle strength. We have to have strong muscles to have healthy joints. Without the muscle strength being there, the joint can't support itself. So muscles and joints go hand in hand right together. And that's a big part of physical therapy, is getting the system stronger to endure challenges that we face and endure these circumstances we may not expect to happen to us. The third thing here is we've got increased bone mineral density. Now, as we get older, we lose this mineral density due to nutritional changes, due to not getting enough sunlight, not stimulating our body with a proper exercise rehabilitation program. We need certain amount of stimulation to our bones for our bones to remodel themselves to maintain their strength. And we see a lot of people start having issues with this, especially around 70 years old and up. So several factors that go into this improved bone mineral density. Physical therapists can really help to load our structures, load our bones in a progressive, safe manner that's going to maintain this bone mineral density. And the reason that's so important is when someone falls and they don't have good bone mineral density, they're more likely to have a fracture. And when you have a fall accompanied with a fracture, this is one of the leading indicators of a life-changing event for most people, and could mean going from living independently to now having to go into assisted living or having to employ a caregiver almost full-time, if not full-time. The final benefit of physical therapy to the musculoskeletal system is improvement in balance and endurance. We'll go through some of this here in just a minute. We talk about neurological systems, which brings us there. There are several different neurological disorders that we work with. We've got neurodegenerative changes. We've got neurological and pathological conditions that affect our body and our mind. The physical therapists are educated and provide instruction, and then also a comprehensive rehabilitation plan for each individual depending on the neurological disorder or dysfunction. So we work with Alzheimer's, Parkinson's, ALS, strokes, people with vertigo, a lot of different cognitive disorders that people undergo. And it's important to look at these different factors that each pathology has, because every patient will be different, and you need to know of all these factors, all these symptoms that this patient is undergoing, to get the right rehabilitation plan for that patient. So that's something that physical therapists have been helping with for a long time and will continue to do so. So these benefits to the neuromuscular system from physical therapy is number one, fall prevention. So like I just mentioned, we have patients that have falls and some kind of bounce back pretty quick, get these deep bone contusions, but no fracture. We see these people come back, they reestablish their quality of life pretty well. Where if we have a patient that does have a fracture, say of the hip or the femur, they will have to be immobilized for up to 8 weeks. And if you can imagine someone at 60 years and above getting 8 weeks of immobility on their body, there are a number of repercussions. We see people's quality of life dramatically drop after that. So a big part of what we do is to get people stronger, improve their balance, improve their endurance, improve their postural awareness. And that way they can understand when they're going to fall, or know what the risk factors are prior to climbing some stairs or getting in and out of a car. So simple activities often become much, much more challenging for these adults with neurological issues. So as I mentioned, the second benefit of physical therapy is to improve upon weakness, fatigue, motor control, and body spatial awareness. We see a lot of stroke patients that come back after having a stroke with a variety of differences with weakness and all these different factors. We, as the physical therapist, have to identify the symptoms going on, what this patient is lacking, and what is going to be most beneficial to that patient, and how we can get them back to a normal, if not relatively normal way of living prior to them having that stroke, which takes us into that independence. So independence with our functional tasks is another really crucial reason PTs are very beneficial for these neuromuscular patients. There are a number of different tasks that we take for granted when we're a bit younger, that after having a stroke or after having a neurodegenerative change come on, we see people not able to do simple things like reaching outside of their base of support, caring for themselves, grooming, dressing. A lot of activities of daily living are jeopardized when a patient has one of these neurological conditions. And again, we'll mention it probably for the third time now, is the control of incontinence. Neuromuscular and cognitive retraining, our physical therapists are taught how and when to identify these factors where we do need to step in and employ a strategy for our tummy muscles and our pelvic floor muscles. We'll actually talk about one of those here in a minute, and how to activate it, how to carry out activities with it working, and then over time it actually improves our incontinence. So wanted to bring this up. We have numerous fall risk assessment and prevention strategies, and this group from Fresno State University put together this little checklist here, which you guys can look at and look at the action plan, look at the risk factors. If yourself or someone you know needs any help with these, you can turn to this right here. Well, we work with a lot of different factors that help to prevent falls, and just kind of going from the top down, our inner ear, the vertigo, the dizziness we experience from our inner ear problems. There's a host of different inner ear changes that happen as you age. We can assist you to identify what's going on and then to work on strategies. There are a number of different techniques that we can use to assist vertigo. And if anybody's ever had it, it's a crazy feeling that you can't control, and to know some strategies you can utilize to better that condition for yourself or a loved one is crucial. We are educated in it, and it's a challenging topic because most adults will face some type of vertigo as they get older. We also look at the feet, the footwear, and then if we do have like a diabetic neuropathy, we have to assess where this patient is numb on their feet. How numb are they? Do they have any feeling, or is it completely numb? These factors employ a strategy to improve the footwear, the gait of the patient, how they walk, and then also to be aware of any precautions coming up, like not being able to feel a rock or a sudden change in elevation. We do work with some visual deficits to these fall risk patients. We can work on our visual fields and employing strategies where we try to eliminate a visual field and challenge a patient to use the visual field that has the deficit. There's a number of strategies involved with this. Along with that, our weakness, endurance, and flexibility. I can't even tell you how many times I've heard about a patient having a significant fall from trying to reach an object on the ground or an object outside of their base of support. Posture, our posture is crucial. If we are forward flexed at the hips and have a rounded mid back, and we walk with our walker or our cane, or if we don't use an assistive device and are hunched forward, we are much more likely to have that fall risk than if our posture is more upright and we can maintain that postural awareness. So our gait and our walking mechanics. So there's several factors that involve clearing your foot when you're taking a step while you're walking. These factors include picking up your toes, being able to push off your toe, being able to pick up your lower leg, bring your knee upwards, extend your knee, straighten your knee as you walk. We look to identify all these little factors that cause falls, that break down our falls, and finding these strategies to create a rehabilitation program to get out of this gait mechanics that we're doing. Easier said than done. We do have to employ a lot of different strengthening, functional strengthening, to actually achieve these impairments, these benefits to these impairments. So another one is our medications. Our medications do affect our ability to not only cognitive, but also to sense things around us. If we're on a bunch of painkillers, we're less likely to have good proprioception, which means understanding where our body is in space. Medications do a number of different things on us, so we have to be able to identify if any side effects are happening, and then how we can relate that information to your physician, and possibly come up with a solution. Any medical problems, this is kind of a general statement. You go from having, arthritis or heart problems or osteoporosis or diabetes. The physical therapist will assess the conditions you're going through and give you some steps and some ways to get out of this pattern that you're in. We also have fear of falling is a big one, and that can be, misinterpreted as maybe being extra cautious. Some people are, excuse me, reluctant to take a step or do something based on the fear of falling, even though they know they can do it. That causes a cognitive disruption, which we can see issues involved with falling just based on the patient having an extreme fear. We've also got cognitive difficulties that can go from a variety of mental issues, from forgetfulness to dementia. We have to paint a safety picture for each patient, and if certain activities are jeopardizing that safety perspective, we need to make sure that for example, a caregiver is with that patient, or a physical therapist, or someone, a family member, when it's performed. And that also brings the household hazards and living alone challenges to each patient. We look to identify how much sources of help a patient has. If their family's there, if their spouse is there, if their sibling or anyone, we need to know who's involved and how much assistance these people need. Because falls happen all the time and we don't predict them. A lot of times they happen in the middle of the night, or when someone is doing something routine that they've never had issues with prior, and somehow start to have problems with them. So the important effects of aerobic exercise, kind of summing up what we've just been describing about the cardiovascular system, the musculoskeletal, and the neurological. Exercise really affects the mitochondrial enzyme production. Now, if you're not familiar with what mitochondria are, I refer to them as the food truck in front of the construction site. They're the energy providers, the energy builders for our cells that need to regenerate an area, that are building bony tissue, ligamentous tissue, muscle tissue. if we don't have these mitochondria, if they're not active, they're not being recruited into this area, there's a less likely chance that the cells to build the structure, to regenerate the structure, do not have the energy to do their job. And that is crucial. It goes across kind of all facets of exercise, rehabilitation. We try to stimulate these guys, and the way we do it, we'll talk a little bit about here in a minute, is through some modalities like pulsed ultrasound and cold laser or low level laser. We've actually seen these two modalities stimulate the production of mitochondria, which gives people a better healing response, gives people a better chance to successively recover from whatever injury they go through. So second, bone density. We've just talked about this. I'm reiterating it because of its importance, especially with our fall population. It is crucial to have that strength of the bone. And then third thing I wanted to mention was normalizing insulin levels for people that are diabetic, that have had issues with diabetes. Exercise has been shown to improve insulin sensitivity, and that means that your muscles are able to eat more easily, absorb the insulin and glucose during or after an activity, making sure they have the levels that they need to function. So now let's talk about more about this treatment that we've been going through, treatment and rehabilitation. So we've got exercise. Now, exercise rehabilitation, it sounds fairly general, but we break it into a very specific a step of processes for each patient. Everybody's different. So everybody's got a shoulder, a back, a neck, some type of injury that we need to assess what's going on, assess the angles that your body can move in, assess the strength levels, if something is weak or strong. Muscles can be weak and tight, or they can be tight and strong. So there can be a variety of changes based on the patient's pattern of living, the musculature they've been using, if they're a walker, a jogger, they like to play tennis. Everybody's got some differences within their biomechanical structure that's going to have to be identified in order to get this situation alleviated or remediated as quick as possible. Nobody likes to be in, therapy forever, so we want to get this done on a quick timeline, and we really need the patient's participation as well to employ these home exercises, to do these exercises we train them on. Because just because you do an exercise once does not mean that you're a master of it. You've got to practice these things and then go through them on your own and with a therapist so that you get better and better and better at them. Now, one thing I really employ with the physical therapists that I work with is to do manual therapy. Now, manual therapy is an umbrella term that involves a lot of different soft tissue therapies, including massage, sports massage. There's a variety of different massage that goes from percussive to active release technique. There's just a whole bunch of them. The therapist needs to be good at this type of therapy because sometimes exercise doesn't fix everything. And you do need to have a muscular structure released to quit its pull on a joint or another structure nearby. We found that with the right application of manual therapy, we can get these prolonged results and speed up recovery time. Along with the soft tissue component, there's also mobilizing the joints of our body. So our spine and our peripheral joint system. We have in physiological terms a neutral position with each joint that is in our body, meaning it's the joint where the or excuse me, it's the position where the joint has the best amount of available space in between the bones, to where if you, for example, on the elbow, if I do this or if I fully extend, there are positional changes within the structure of my elbow that either compresses the joint or relaxes the joint. And so we can work with the spine and our peripheral joint system to gently push that structure back into the neutral position. Once we do that, that assists the neurological capacity of the muscle. It assists the function of the muscle. So it can have a direct effect on the nervous and muscular system by doing joint mobilization. Now, some physical therapists are qualified to do joint manipulation, which is the high velocity thrust that chiropractors use. And that can also be very effective, done at the right time in a person's treatment. And it's not something that we look to do repetitively. We want to break away from those manipulations. We also have several different modalities to control pain and inflammation. I mentioned a couple of these previously. Another is TENS, or neuromuscular electrical stimulation. There are ways that our body improves its healing response by the use of different modalities. And then another concept for our treatment and rehabilitation is the home exercise program that we employ with you guys and progress as you get better with your therapy, you get better understanding, you're starting to get healthier, we can start progressing that home exercise plan. Okay, I wanted to go over some PT pro tips with you guys. Just quickly talk about a muscle called Transversus Abdominis. This is a deep layer of our abdominal wall. It's the deepest muscle in our abdominal wall, and it's actually what we would call the core. So the term core is used very widely, an umbrella term, and this is the actual muscle we refer to as the core muscle. So we'll talk about that here in a sec. I want to go through with you guys some neck flexibility and mobility, and then some postural mechanics with sleeping, sitting, resting, and then some strategies for low and mid back pain relief. So let's just look at this muscle real quick. So right here, I've got this arrow. You can see it's the deepest layer of our abdominals. So we've got our rectus abdominis here, external oblique, internal oblique, and the transversus abdominis here. So it acts like a corset on the pelvis and the thoracic cavity. It does not move our spine like the other muscles, the abdominal muscles I mentioned do. So that's the reason we call it the core, is it simply pulls everything together, holds it in place, and allows the other muscles to work with better function, with more efficiency. So wanted to get you guys, so just quickly, the origin, the insertion, the action, and if you're interested in the innervation. But I wanted to show you guys, look at these muscle fibers here. They run horizontally. So it really is a compressor unit around your thorax and your abdominal pelvic cavities. But interestingly enough, this deep layer of the muscle connects to the fascia of the pelvic floor muscles. So this is what commonly we have issues with incontinence, and it could be postpartum after giving childbirth, or age-related incontinence over time. And for example, a woman, a brilliant physical therapist named Shirley Sarman actually started to experiment with this back in the early 80s. And it was primarily to help women after giving birth to their first or second child to retain and regain control of their bladder function. So the idea of this exercise is you're not moving a whole lot, but you are activating this muscle by drawing your belly button straight down. You can do it in your chair right now where you draw your belly button straight back into the chair. Now, it's not flexing your stomach down or flexing from the sides or rotating. This muscle simply draws the belly button straight back to the spine. And you can hold this for a period of 10 to 20 to 30 seconds and try to breathe normally as you do this. Now, what Shirley did was she broke these exercises into levels, where the first level was just being able to hold the contraction and breathing at the same time, which is actually really difficult if you haven't done these before. And she employed subsequent levels of intensity based on a heel slide, sliding one heel. Now, what this does is as you slide this out and bring it back, is it makes your back want to arch. Through this muscle contraction, holding it down and keeping it tight, you keep your pelvis and your lower back still, where there's no movement. You don't have your back arch. You don't have one of your hips raise on you as you extend this leg. And so in doing that, moving very slowly, it gives you a hell of a workout to that muscle, to this transversus abdominis. And then once you can start to hold that for, say, 10 repetitions and do 2 to 3 sets, you can start progressing into these upper levels of this exercise. So next thing I wanted to go over is some neck mobility, and I'm probably going to buzz through some of this stuff fairly quickly. But we all have these resting positions, these positions we hold our neck in all day long, and we need to adjust our body position, adjust our neck. And it could be doing some of these stretches, doing some of this mobility, getting up, going for a walk. These are common exercises and stretches that are done in physical therapy. We've got one with the first one up here, our neck tilt, for these suboccipital muscles that get so tight with our forward head posture or looking down too much. Just even doing a gentle neck tilt can stretch these muscles. Now, with all of these exercises, you can add in a little overpressure. So for example, this neck tilt, I can add a little overpressure by just tucking my chin here with my hand, and then I can gently, by using this nub in the back of my head, I can gently pull down a little bit. Now that can also change from going from side to side or down rotation. So these other examples that they're showing here actually go through some of this stuff. You can add in your opposite arm to add a little bit of overpressure, which is going to give you an increased stretch here. You know, we all need this probably once a day at least because of the way we look at our phones and look at our computers all day. So along with this, our rotation. So looking at which side can we rotate more easily to, where we have more range of motion. Most likely we need to work towards the opposite side that we don't have as much range of motion. And then another one to combat this neck tilt and this forward head posture we have is our neck retraction. So it says neck stretch here, but that's actually a movement which we call retraction, where we pull our neck back. Okay, you might do this 10 times in a row. You might try to do it and hold the position for up to a couple minutes, depending on what's going on with you. Next thing, looking at our sitting, sleeping, and rest positions. So this slide covers our sitting position. So wanted to show you guys this angle of these dots here. So one represents what we call our greater trochanter. This is the head of the femur, where it comes out towards the side here. It's the bony prominence we can feel. And then we've got the midpoint between our femur and our tibia. Now, the reason I'm showing this is it's important that you do sit with this top point a little elevated below this bottom point. If you sit with the top point a little lower or under the bottom point, all the weight from your upper body goes into your lower back. That causes tension in your hip flexors, tension in your back, and then you get up looking like you're bent over almost. So really crucial to sit at an elevated position where your legs can take some of the control, some of the body weight off of your spine. Now this can be done with an exercise ball like you see here. I would say she needs to sit a tiny bit higher, but that's not too bad right there. And then again, you can also do some standing. So I recommend if people have back problems, neck problems, mid-back problems, they spend possibly 5 to 10 to 15 minutes in each position or longer if you can endure it, and then try to rotate out of that position, maybe sit on an exercise ball a little bit, maybe you're standing for a few minutes as well. Now this is a big one, our sleeping positions. So how we have our body in position while we're sleeping is crucial to not only getting enough sleep, getting enough REM sleep, reducing our cortisol levels, reducing those hormone responses to stress, is we work on if we're a back sleeper or a side sleeper. If we're a side sleeper, we need to put that pillow between our knees, under our ankles as well. I also like putting a pillow under my top arm. And of course, all these pillows will kind of have to flip with you overnight, but it puts your spine in an anatomically correct position where you're not kind of going into these upper body or lower body rotations. Your spine is following your appendages. So if your legs are rotated, your spine's going to be rotated. So we see a lot of people sleep on their tummy that have either neck or lumbar spine problems. And we need to look at some adjustments with pillows, either like I mentioned, in between your knees and between your under your arm, or if you're a back sleeper, to sleep with pillows underneath your knees. This guy has a good strategy here, similar to what I would do, is put one kind of higher and then one a little lower for my feet. If you have a harder or softer bed, you'll need to accommodate pillows. She's got a towel right here for some back tension. You'll need to look at some of these different strategies based on your bed, and your bed is crucial. So spend some time getting the right bed, looking at what your friends have got. I always tell people to go try out multiple beds at one of these mattress stores. I know that's a little more challenging right now because of COVID. So I would research, ask your friends. I personally use the purple mattress, the second to firmest purple. It's amazing. So I highly recommend that bed for any of y'all looking right now. So our resting positions, these, just like our sleeping positions, are crucial to giving the body some space, some time to recover. So when we have any type of injury, say, this patient here with his shoulder, looks like he just had shoulder surgery. He's got his elbow elevated with some towels. Trying to find that comfortable position is very difficult after a surgery. So, this is something y'all want to think about prior to having a knee replacement, prior to having a hip replacement. I've got a patient right now who didn't have a lounge chair prior to getting her a total shoulder replacement. And she had a hell of a time trying to get comfortable and sleep. And that is really important for our therapy the next day. If she's sleepy, if she's inflamed, if she's got all this cortisol running through her, she hasn't slept well, she's most likely not going to perform that well with PT. This person here has a pillow under the shoulder as well as a pillow across the body. I like this a lot. That keeps our shoulder in that resting neutral joint position. Now, sometimes, these might only be done for 10 to 20 minutes at a time, but, as most of us know, as you get a bit older, just having that little bit of extra time to recover during the day or the late afternoon can really help us have less pain, have more energy for the nighttime activities. And then, of course, just last but not least, this zero gravity position. However you can achieve it, However, it's going to be employed by you. The position that the body is in with this slight kind of incline for the knees and then incline for the back really helps get your spine in a neutral position and really helps to get this healing to get the inflammation out, get the healing to continue to regenerate the area. If we're talking about a surgery or if we're talking about a chronic back problem, inflammation is constantly filling up space in your body, and we need to get either with these positions and some ice and possibly anti-inflammatory medication. But these become very important for just a 15-minute relaxation to calm the nervous system, calm the body down quite a bit. Okay, last thing on our treatments is our mid and low back pain. I'm sure some of you guys have already employed some of these strategies where getting our body into what we call a 90-90, so 90 degrees knee flexion, 90 degrees hip flexion, really allows the lower back to open up from this kind of pinched or compressed position it gets in during the day. Now, if you don't have a nice gymnastics mat or carpeted floor, really put down quite a few blankets or towels and support your body with those, because it's going to get uncomfortable being on the floor for a long period of time. Now, I love this chair, cat and cow. So you're arching your back and kind of looking up, trying to lengthen your spine while you're in your chair. And then you're reaching forward and rounding your spine, dropping your head, trying to lengthen these muscles. You can kind of reach this one all the way down to the floor if necessary. The mid back, this can be done for the lower back or the mid back and even the neck. You guys can do this right now if you just move yourself back in your chair, reach out to your desk or your table or wherever you're watching this from, and hold on, and then just kind of lean back to where you're allowing that vertebra to open up and to decompress. So along with our decompression here, we want to look at some rotation and then some extension with our spine. So these rotations you can do in your chair. Now, you know, what I would tell you is observe which side you can turn with more range of motion to. So if I can turn to my left or my right better than my left, you'll want to go and work on the other side that is having more restrictions. Now, and this is taken with a grain of salt because everybody's got a different body type. So we will, the physical therapist will help you to identify which way to go and what are the best strategies for you. And then last but not least, this extension. I'm sure most of you guys have done this one, but reaching back over you. A lot of us get this real rounded mid back as our lives progress and do a lot of work and stuff. So this combats that by going against that flexion of the spine and gets it into extension. So really can help relieve a whole lot of pain. And so all of these different benefits for the from physical therapy for our older adults, our active adults, is getting you the right rehabilitation plan for yourself. Everybody's different, everybody's unique. We want to help address your problem and get you back to playing golf, playing tennis, whatever you want to do. So it's not our way or the highway. We want to make sure that you guys have your needs met. You know, for anybody that's undergoing knee, shoulder, hip replacement, there's a strict adherence to a protocol that your surgeon will want us to embody. So we have to follow this, and it's very important that we do it with each patient that's required. We also have a lot of need to prepare people for surgeries, for back, neck, wrist, elbow, any kind of surgery. You need to have a strength of your body to endure a period of time of immobility. And this means training up with the level that is possible to you before your surgery, doing some release to the structure, manual therapy to employ a better recovery, a better rehabilitation prognosis, and getting you back quicker. We also do advanced manual therapy, which I mentioned previously. Can be crucial to getting the body back quicker, not waiting, and kind of relying on chance of structures opening up or through exercise. Sometimes we need to have that extra little push and get those people healthy. And then we develop that individual treatment plan, exercise plan, home maintenance plan, and we leave it up to the individual, the intensity of the plan they want to endure. Some people don't want to do more than twice a week. Some people want to do it every single day of the week. So what we like to do is to continue to develop that plan according to your progress and how you feel during it. And finally, what do we need to do to get to see a PT? You do need a physician referral. So most of the time, physicians like to see their patients within the last 60 to 90 days prior to writing a order for physical therapy. So you will need to make an appointment with a physician, or you can do a telehealth appointment as well. Next is our insurance coverage. So, if you do qualify for Medicare, having a secondary insurance plan will pretty much let you do a lot of therapy and meet your needs with it. If you do have other types of secondary insurance or private insurance, or you don't qualify for Medicare, you'll need to check with your physical therapist to determine the best plan of action and what is covered by your insurance company. And then, of course, our transportation. So if you can't regularly get to where you want to go, we do have home health services if you are homebound. There is outpatient that can come to your home, but the important thing is to find a nearby clinic, possibly someone's recommended it, someone that you trust, and to find something that really works for you. Well, that's about it, guys. I'm pretty much done. And if you guys have any questions, you're welcome to comment or ask our questions to the admin or the staff that are maintaining this call. You can also come back later and ask for my email address. We can discuss privately what's going on with you. But as of now, that's about all I got, and I hope everybody has a great day. If you guys, again, if you have any questions, just reach out to us and we'll be happy to answer all that. All right. Well, I'm going to sign out. It looks like you guys are doing all right, and wanted to just thank everybody for the time, and y'all all have a great day. Thank you.